So I first learned about trauma-informed care through the youth treatment program, and Tom Quintana and Michelle Simone both basically brought that to my attention. And it was the first time I'd heard about trauma-informed care. And at first, I have to admit, I was a little skeptical. I wasn't quite sure how it applied. And it took me some time to learn and understand more about it. And now I'm very clear about how important trauma-informed care is, learning, trying to understand how our childhood experiences can have an impact on our evolution as adults and how we interact with people. So I think it's been really helpful for me to learn about it and understand it and to bring it to the work that we do here at Transitions Mental Health Association. I think trauma-informed care has helped me to think differently about the people we serve, to work harder to understand the experiences that they've had, the traumas that they've experienced in many cases, as well as to interact with staff and really even my own personal relationships. I think I understand more about how trauma has impacted my spouse and me, my siblings. I didn't at first think that trauma had been part of my life until I really learned more and realized that having a parent with a chronic illness and having experienced family members who had died by suicide, that those things all had an impact on me that I had minimized until I learned more about trauma-informed care. Probably one of my best examples is in dealing with a person who used to receive services at Transitions Mental Health Association who really was struggling and had left treatment and I think has just been really struggling since then. And so to feel more understanding and empathy for that person has been really helpful. I think too, even just talking to the community about mental health and about our clients, about many of their experiences, also our staff who have lived experience, and then staff who haven't had lived experience but still have experienced trauma. I feel like it has just helped us elevate as an organization to really be more empathetic, to have more hope, to have more understanding about where people are coming from. And I think that just improves our communication as a community. Honestly, I think as a nation, if we had more trauma-informed communication, understanding, I think it would elevate our entire national discourse. I think post-traumatic growth really comes when someone has learned to understand and accept trauma, their childhood experiences or even their adult experiences. I think once someone, including me, comes to understand what those experiences have impacted in someone's life, then it really helps someone to take that understanding and move to the next step, maybe to communicate differently, to be more patient, to be more empathetic, just to lead with curiosity and to assume positive intent, some of the things that we talk about here in our collaborative conversations. I think that's what can really be gained by having a post-traumatic understanding. The absence of trauma-informed care and understanding really is just locked communication. It's communication that doesn't bring empathy and understanding, doesn't assume the best of the other person, doesn't take into account how maybe my experiences and their experiences could be colliding. And I think it just decreases the level of connection and an ability to really move forward with communication. I think it really is limiting if somebody doesn't have some sense of understanding of the impact of trauma. We have to have hope for the people that we serve, that there is always an opportunity for people to do better. And that's sort of what we talk about here. We always have an open door policy that even if someone goes away, they haven't been able to move forward with their recovery, they haven't been able to move past their own trauma, that as an organization we hold hope for everyone we serve. I'm really grateful that trauma-informed thinking has been brought into my life, and I think it's really important for us here at Transitions Mental Health Association to keep that in mind always, as much as possible, about the impacts of trauma on the people we serve, our staff, ourselves, members of the community who may come to us with fear and a lack of understanding about behavioral health services. That trauma-informed thinking really can be just an overall elevator of discourse and communication and understanding. So, I'm really proud of the organization for bringing trauma-informed care into the community.